Hi everyone, my name is Tianyang Xie. Today I'm here on behalf of our Team 5 to kick off with our Phase 3 presentation on the problem solution. I'm going to start with how we gone through the whole process. Under the Phase 1 problem recognition, we started with an interview of Ken, a Marine Corps veteran who had experienced 5 years of homelessness. We have learned from his story that shortly after getting out of the Marines, he was offered a job by a fellow veteran, but unfortunately, he lost the job 3 months later because of lack of support for basic needs like lingerie and transportation. The story of him and his words open our horizon that the most urgent needs for homeless population might not be something big. It could be the small barriers that are causing them big troubles. In this video clip, Ken explains in his own words.
The way I view it, based on my experience, being somebody who experienced homelessness and as somebody who's tried to help people get out of homelessness, what may be a regular obstacle to somebody who has a bank account, who has a house, who has an ID, who has access to transportation, who has access to nutrition, who has access to get their clothes washed or access to a computer to write a resume or to vocational rehabilitation services or the internet. I mean, all these things, right? To us, they seem minimal. But to somebody who's struggling with homelessness, it's amplified.
With what we learned from him, we dig further into the problem by qualitative secondary research and build our high-impact question that how do barriers to accessing existing service prevent people experiencing homelessness from moving into stable housing? Can we predict which of these barriers will present the most significant obstacles to individuals in the population served by DHS and prevent them before they can cause a return to homelessness? Based on our research, we have chosen 4 focus areas: access to basic needs, transportation, communication, and identification. Next thing is that we brought what we found into the quantitative research phase. Though we didn't find exact data records telling us how those 4 areas are affecting homeless population in daily life, we do find that people who receive public benefits are more likely to have their health situation improve through time. And we managed to figure out a model predicting whether a client would have possibility to upgrade the living environment or not. The model still has a lot of room of improvement. The accuracy could be better with more completed data sets, but it's still helping us to realize the importance of those basic daily life needs to homeless population.
Next, I'm going to talk about more on the model application. Our model is doing a pretty good job on the housing improvement given a homeless person's condition. We target people who come to register and would like to share their personal information with us. We can provide them the best prospect under the current condition. Of course, there are people whose outputs of housing level will not change or even decline by the prediction. So in this way, we can inspect which factors that they input into our model lower the possibility of them making better, such as factors that below the average. For example, a homeless person predicted to be declined on his housing level, and in reality, he didn't get the public benefits, while most of people have done so. Therefore, the public benefits might be a factor that helps to make his life easier. In a word, we can expect the shortage for a specific person and effectively provide them what he critically needs and save costs and save resources for someone who actually needs the benefits. At the current stage, the accuracy of our prediction model is more than 70%, reaching the level where it's practically precise, but it will become more powerful with this polishing. To be sure, from Tianyang's intro part, we can recall that the public benefit truly has impact on housing improvement level, just as the picture shows at the corner. The current public benefits include help on food, medical care, and money, but we want to incorporate more social benefit services that are related to our small barriers. So this is the first step. The second for our technique plan is using the standardized data collection system. From the previous stage, when we were doing the data cleaning, there are tons of blur and useless answers blending in the dataset, which totally lowers the speed for data processing. The system doesn't need to be much complicated. We just need a drop-down box and several fixed options for each question. So in this way, we won't waste any questionnaire and get useful information as much as possible. What's more, the model can be improved if we keep tracking more people into our system. With non-stop training and testing, prediction would be more accurate. Meanwhile, the customized help will be more precise and save costs for other homeless people. It is a tool that is sustainable and will become better and better as the organization polish it continuously. Our teammates will talk more on how to execute it with the cost as low as possible and how the added social determinants serve homeless people.
In addition to proposing a way to use our data model to address the issue, we wanted to respond to the judge's feedback asking for specific actionable ways to address the barriers that exist to accessing basic needs services. To that end, we proposed the creation of the BASIC program. BASIC stands for Bringing Accessible Services into Communities, and will provide pop-up service centers in the highest need communities to connect the county's most vulnerable residents with basic needs services. Our data model from phase 2 indicates that people who receive public benefits and therefore have a set of their basic needs met see an improvement in residence type at a higher rate than those who do not. Based on this data, we believe that increasing the number of people who have access to benefits, as well as increasing the number of basic needs met, will allow more individuals to move towards stable housing. As we noted in phase 1, there are many services available to meet these needs, but barriers exist that prevent people from accessing those services. Here, we return to Ken as he identifies a significant barrier in many high-need communities.
Where we live in Pittsburgh, there's a bus line, and there's a DMV within 3 miles, or probably 3 to 5 miles, maybe-ish. However, there's a lot of poor folks in rural areas. If you're poor and homeless out in Sarver, PA, you don't have access to a DMV.
In fact, a 2015 study of upward mobility from Harvard University found that transportation barriers were the strongest factor in decreasing the odds of escaping poverty. Increasing access to transportation is costly and time-consuming, but the barrier presented by lack of transportation in meeting basic needs can be overcome by bringing critical services to those who need it most and do not have the means to travel to specific offices and service centers. Our recommendation is that DHS create pop-up service centers in areas of highest need who are not served by public transportation. In this way, DHS can connect people to basic needs services by bringing the services to them. Using data from the DHS report, Suburban Poverty, Assessing Community Needs Outside the Central City, we identified 15 areas that are high need and are only served by limited bus service. These would be the areas in which the pop-up service centers would be held. To keep costs low, we recommend that DHS work with existing partner organizations in these areas to host the pop-up service centers. In this way, DHS will not take on any facility-related costs. Pop-up service centers would be available within these communities on a specified schedule. DHS can determine the schedule based on community need, resource availability, and budget. This is one way that the program can remain agile and be adjusted to meet DHS financial and logistical parameters. The basic needs service providers with whom DHS already works would be invited to provide their services on location to community members. Using DHS Community Information and Referral Packet, we recommend including the organizations and services listed here, at least to start. In addition, we recommend developing additional partnerships with drop-off laundry services such as Allegheny Laundry and Allegheny Textile Services, and creating space for basic needs maintenance, such as providing charging stations and internet access.
Assuming that partnerships between DHS and existing organizations are established, one of the advantages of this suggestion is that costs can be kept relatively low. We anticipate that creating the infrastructure of these pop-up service centers would simply require the addition of a staff person to keep it running. Based on a search from LinkedIn and Glassdoor, the average total compensation of a county service coordinator is about $18 per hour. In addition, for our suggestion, cost can be considered a function of frequency. While it would be ideal to provide these services as often as possible, our proposal can be adapted to a monthly basis or any frequency that is within the DHS's financial and logistical parameters. Despite ongoing costs, we can also begin to quantify some of the benefits. The DHS report titled Understanding the Allegheny County Homeless Population tracked costs related to housing services among 2,033 people. The report detailed that the cost for one individual is about $216 a year. Our data model predicts that by increasing access to basic needs, DHS can see a 9% increase in the population that is moving to stable housing. Given the 4,000 people that DHS serves through their housing programs, our suggestion could help the department save approximately $80,000 a year. This model is not entirely new, so we can observe some of the financial benefits that other comparable programs have. Our suggestion is very similar to the mobile health clinics, which have a similar goal to ours, to create better links between the community and the available services. One study looked at the popular mobile health clinic in Boston called the Family Van. And the study reported that for every $1 spent, the service brought a return of $36. Pop-up service centers are cost-effective and can have an immediate impact on the county's most vulnerable population by connecting them with existing services. To conclude, we'd like to end our challenge by listening to the voice of the people experiencing homelessness and letting their experience guide the solution that will make a difference in their lives. Here are Kent's words to close us out.
In order to truly tackle a problem like this, we need a different kind of thinking, right? We need to understand what the people are going through, what people are experiencing from their eyes, from their levels. We can look at stats and data all day, and stats and data are important. I'm not saying that they're not. Research is important. I'm not saying that it's not. But there's also a human component that needs to be explored, identified, appreciated, and fit into the equation if you're truly going to find a solution that works.